morning, so we're all there, right? I just want to cry. Okay,
Frustrated.
frustrated.
All right, guys, this is my research study proposal on nurses providing education for diabetes. All right, so the number of people diagnosed with diabetes in the United States continues to rise. According to the American Diabetes Association in 2015, 30.3 million Americans had diabetes. This rise in diabetes diagnoses equals an increase in responsibility for the nurse. It is the responsibility of the nurse to provide education to his or her patients. Without proper education, serious complications could arise. These complications could be evidenced by an increase in hemoglobin A1C. A proposed solution to this problem is to establish a diabetic education program. According to the Center for Disease Control and Prevention, diabetes prevalence continues to rise. About 1.4 million new cases of diabetes were diagnosed among adults aged 18 to 79. Diabetes is the body's improper use of insulin. There are two types of diabetes. Type 1 is when the body does not produce insulin. Type 2 is when the body does not use insulin appropriately. All right. Diabetes can be overwhelming. When a newly diagnosed diabetic patient is discharged without adequate education, that patient is at risk for numerous complications. The diagnosis of diabetes can be very complex and hard to understand. The patient must undergo a lifestyle change. In addition, the medications can be very overwhelming. There are medications that are short-acting, long-acting, and even intermediate-acting. The above factors can cause patients to be unclear about diabetic self-care. In order for the patient to have effective diabetes management, the nurse must provide adequate education on all aspects of diabetes. All right, guys. I have presented 5 research studies in regards to diabetes. The first study was conducted to determine the differences and perceptions of diabetes management between diabetic patients and their nurses. The patients and nurses completed 4 questionnaires. According to the authors, the results of the study showed there is a significant difference in the perceptions of diabetic self-management between nurses and diabetic patients. The scores between nurses and patients on health education needs were also significantly different. The next study is in regards to the effects of diabetes education. The authors conducted a study to determine the effect of a diabetic educational program on diabetic patients' A1C. The participants were asked to answer a 41-question questionnaire. According to the authors, self-care behaviors improved, statistically significant after months of educational intervention. The study results also showed the average A1C also decreased after proper education. The next research study is in regards to cost savings. The authors conducted a study to determine the long-term cost savings associated with primary care management of diabetes. The study participants were involved in a diabetes system of care. The study results showed the total medical cost savings associated with providing this care to patients was approximately 6.9%. According to the authors, patients that are provided education may reduce long-term cost of care. The next research study was in regards to diabetic education program. The authors created a testing method to evaluate the effectiveness of diabetes education program for nurses working in hospitals. A quasi-experimental pre-test and post-test was completed for the nurse to evaluate effectiveness of diabetes education. These study results showed a significant difference in modified basic knowledge of diabetes. The diabetes education program positively impacted nurses' knowledge of diabetes. The last research study that I have presented is in regards to self-monitoring. The authors conducted a study that involved 128 participants at a medical clinic. The participants were enrolled in a clinic that focused on 3 strategies. Study results showed participants in a combined approach had significant decrease in A1C of 0.6% over a 6-month period. The study also showed a more significant change in A1C from baseline to 3 months with combined approach rather than health information technology enhanced self-monitoring blood glucose. The study showed a combined approach presented the most significant results. All right, so this is what my actual research study proposal is. The PICO question that is to be researched is, will a patient's A1C improve after providing adequate education on a diabetic program? Patients in my program will be enrolled in a diabetic medication program provided by the nurse. After adequate education is provided, the patient, the education is proved effective as evidenced by a decrease in A1C. Theoretical framework. There are many nursing theories that can be applied to this research study. Imogen King's nursing theory of goal attainment is one that really focuses on the nurse-patient relationship. All right. The design, setting, and sample. The research study that is to be conducted is a quantitative study design. The participants that agree to participate will have their A1C levels measured at the beginning and end of the study. This measurement will determine the accuracy of providing diabetes education to diabetic patients. The study participants would not include newly diagnosed diabetic patients. The study method involves a control and experimental group. The control group would not receive any additional diabetic education. All right, data collection and analysis. The instrument that will be used for my research study is a hemoglobin A1C. This is the gold standard for diagnosing and managing diabetes. In conclusion, diabetes is an ever-growing and prevalent disease within the medical world. Nurses take on the responsibility of educating all of their diabetic patients. This can be very overwhelming for the nurse and patient. More research needs to be conducted on ways to decrease poor outcomes for diabetic patients. All right, guys, thank you.